So Terry, you've been in the forefront of our office administration, and you've been coordinating our patient appointments as well as all the calls that you get from our overseas doctors. What's the general perception amongst our patients, and how do you find the response of our new patients?
So the general consensus of our old patients are they're very anxious to get back into the practice, whether it's for recare or for
Continuation of care.
Yeah, continuation of treatment. They're very, very anxious. All our new patients have been emergency patients, and they have translated into patients of ours, patient of record. The emergency patients appreciate the fact that we are open and that we are willing to take them in a timely manner. And that we are adhering to whatever the protocols are based on the CDC and the ADA. We haven't really changed much because we've already practiced it. The only thing we've added is the front desk wearing like a mask and or a shield, and we're taking temperatures of our patients. But I mean, all in all, patients are very, very anxious to return to the practice.
Very good. Thank you. Welcome back, Cynthia. You've been with us for over 10 years, and you've been doing a phenomenal job as our hygienist, and you've been an excellent team player. It's been a week since we started work, so tell us about how you feel, what were the patients' reactions, how do you personally feel as a healthcare provider and as a hygienist in close proximity to our patients, generating aerosols and so on.
I have to say that at this moment I am very comfortable with what we are doing here in our office. We're following all protocols that are necessary to keep our employees safe and our patients safe as well. You know, we have patients signing release forms stating that, you know, they are free of COVID symptoms. We're taking temperatures. As the patients come in, we're having them sanitize their hands. We're doing pre-procedural rinses. So that makes me feel very comfortable. I feel that it's very important to come back to work as a hygienist. We all know what inflammation does in the body. And as far as the mouth is concerned, is the entryway to our bodies. And when there's inflammation there, that inflammation travels throughout the body. And I don't feel that it's in the best interest of most of our patients here to keep them waiting for their cleanings. I believe that their regular cleanings keep them healthy, especially with our perio patients. And especially with our all-on-4 patients, you know, we don't want peri-implantitis happening. We don't want failure of implants happening. You know, so overall, I think it's a good thing that we're back at work for everyone.
Great. And then you're taking utmost precautions to make sure that we control and minimize our aerosols. And you're also abiding by some of the guidelines.
Absolutely.
And
yes.
you are fairly confident that this would become the new norm.
Yes.
And we're also sequencing our patients in a way that we don't overwhelm the system.
Absolutely. Absolutely. Yes.
Great.
We have plenty of time in between patients.
Thank you.
Thank you.
Welcome
back to work. Yay!
I'm here with Julian and Lisa, our frontline surgical team. They have been with us through the entire process. Right from the beginning of our lockdown, we took shifts and turns to be able to help our patients who came on emergency. As of last week, we started treating our routine patients. So Julian, how do you feel about coming back to work?
I mean, I do feel very comfortable. I feel like this is the part, this is our compromise. You know, once we sign up, you know, for this branch of, you know, of the health care system, I feel very comfortable. I feel like we still have to follow our universal precautions. This is something that they taught us, you know, from the beginning. So I feel okay.
Very good. And you're okay with the management of the surgeries and whatever restorative procedures we're doing?
I felt comfortable since, you know, day one. This is something that regardless of a COVID, a pandemic, or any other disease, this is something that we follow every day in our office.
Great. Lisa, so how does it feel to be back at work? I know you have some of your family members who were affected by COVID. You took precautions and you had some symptoms in the past, so everything is fine now?
Absolutely. Everything is wonderful right now. I mean, I was very sick in the beginning, you know, loss of smell, loss of taste, but all that's been back since then. And I'm thrilled to be back at work. I feel safe. I've always felt safe. I've been here 15 years plus, so...
23 years, Lisa.
So, I have no problems at all. I mean, we've always followed universal precautions from day one, so there's no need to be, fear in this office at all.
Right, so I think it's a good way to manage the shortcomings of our pandemic, and you guys are the role models for many of the dental team to be inspired and to get them back to work so that we can help our patients.
Absolutely.
And how do the patients feel when they come? Are they concerned? Are they expressing any issues?
Some patients have some concern. They're a little afraid, which is normal.
But we're also very fortunate that most of the patients are actually very educated as far as I feel like they've been, all of the patients that we do get here are patients that have been coming here for years, on and off. But as part of the team, they feel comfortable. They know how we do things in this office.
How do you feel about N95? Are you comfortable with N95?
N95, they're a really great mask. Unfortunately, I cannot breathe with them.
They're too
suffocating, very suffocating. I cannot breathe with them.
Have you tried the other forms of N95, the KN95?
I have, but it's still it's very uncomfortable to work. I feel like if you were working at a hospital set, those will be great. But I feel like just with these with the level 3 face masks that we usually have in our office, it's more than sufficient.
And you feel comfortable and safe?
Yeah, definitely, yes.
Absolutely.
Much more.
So thank you for coming back and helping our patients. It's been great having you as always. And so you've heard it from Lisa and Julian. And be safe. All right, Ms. Nasli, you are here. This is week 2 and you're here for some implant surgery. Tell us about yourself and tell me about your concerns, and are you feeling comfortable coming here, your work environment and so on?
Yeah, I feel very comfortable coming over here because you guys follow all the protocols. That's very important for me.
And you yourself are a professional working in a pharmaceutical company,
yes,
right? So tell us about your workplace.
Yeah, I work in a pharmaceutical and we follow the protocol over there. We had a meeting every single day. Yeah, we try to follow everything.
Very good. You're not afraid of the corona or anything that is happening outside?
Yeah, but if we follow everything, the
according
protocol,
to the standards.
yes, yeah, you feel, we feel more comfortable.
And how do you think our staff is in terms of your experience today and your consent for the surgery?
I feel very, very comfortable coming to work in this office, and I'm happy.
Good.
Yeah, I'm very happy.
Excellent. So you actually will inspire many of the patients who are concerned, and your message will be well received.
Yeah.
So thank you, Nasli.
You're welcome.